Okay, so kind of as usual here, I'm going to talk for a few minutes and then I'll pause for question or comments, but you can break in at any time. This is a small group, so it's fine. You don't have to wait. If you've got a question or a comment that you want to make, or you can put it in the chat box and we will discuss it there. So issues of child safety. So first, I'm just going to say a little bit about the concept itself, which is become used so frequently in child welfare discussions in recent years in all kind of different ways. And so I just recently wrote a sounding board, a commentary, which are these things I do every month, on the different kind of ways this concept or this, you might actually even call it a phrase, it's just being used. And because it's being used in a variety of different ways with different meanings at different times without people being explicit about what they're actually discussing or saying. And so at first, I'm just going to say a little bit about that and then move on to the issues around immediate safety, the kind of issues that all CASAs face in dependency filings and in decisions whether to reunify and the timing of reunification as well there. So for a long, long time in child welfare, there has been sort of a discussion about the goals of child welfare. And those goals are usually identified as child safety, that would be one of them, child well-being, that would be another one. And sometimes there's a sort of a contrast made between child safety and well-being. And it sounds like, these are kind of abstract terms or ideas. And who actually is interested in sitting around talking about a definition? So you would think that, well, these kind of differences of opinion or these views about the meanings of these concepts really wouldn't have perhaps a lot of impact. But I guess one of the messages I want to get across here initially is that they actually do have an impact. So it makes a big difference whether people think of child safety as a dimension of child well-being, which is the way I think of it, not something separate from child well-being. It's a part of it. It's a part of the concept of what it means for a child to flourish, as opposed to child well-being. So for example, what would be a concrete sort of meaning of that distinction? That is, so if someone thinks of child safety as opposed to child well-being, they might, for example, be very interested in a child's physical safety, but not be very concerned at all about the emotional or developmental impacts of child maltreatment, whether that would be severe, not so severe, chronic, or whatever. And so that could have a big implication for how people even think of the mission of child protection systems. I mean, are we concerned, for example, with emotional harm at all? Because you can make an argument in this state that for a long time, but also especially in recent years, since the passage of the Keeping Families Together Act, that sometimes that's explicitly almost stated that we're not concerned with that. And yet, probably, arguably, I would say that probably the biggest impact of child maltreatment over a lifetime is the emotional impacts of that. I mean, as serious as the physical impacts are, and particularly in early childhood,
Hello.
you're talking about lifelong effects here. When you talk about emotional and developmental impacts. So that would be just an example. So again, child safety is being a part of this outcomes discussion, with the outcomes being child safety, child well-being, and of course the other one being permanency, those three, and the discussion about the relationship between and among these ideas. And that would be one way that people talk about child safety. Okay, another way that people talk about child safety is that sometimes it's identified as the primary mission of child protection, of CPS systems. And so again, child safety as opposed, and sometimes, as we're going to talk about here, I'm going to talk about the safety framework that DCYF uses. And so sometimes child safety in that context, that's very, very narrowly defined. And so, for example, in the safety framework the agency uses in this state, Child safety is defined as present danger or impending danger. That is, there's any kind of an immediacy about it. So what I would refer to as the issues related to immediate safety, people using that framework, and I mean caseworkers and supervisors and people making decisions, judges, they're talking about sort of child safety as being the same thing as immediate safety and meaning almost the same thing as danger. For a child to be unsafe would mean that a child would have to be in danger of immediate, not just of maltreatment, but of serious harm from maltreatment. And of course, those are the kind of cases that those of you who are guardian ad litems and CASAs, that's the cases you end up seeing in the juvenile court usually. I mean, it's cases where there's been some kind of either very serious harm that's occurred with the child due to either abuse or neglect, or there's risk or threat of that kind of harm. So I guess the one other thing I would say about the concept of child safety is that for the last maybe 15, 20 years, there's been an evolving sort of I would say by and large, an agreement with people who work in child welfare that there's something different between risk and safety. And so you see this has almost become such a commonplace in child welfare discussions that people feel they don't even have to defend it anymore, that just is, it's so obvious that you don't even have to make an argument that it's true. But of course, it's really, really highly questionable. But nevertheless, in child protection circles, and I don't mean just in Washington, but I mean nationally, there is this view that risk assessment that began in the late 1980s in this state, and I was very much a part of that somehow that has evolved over time to less of a concern with risk, which is viewed as the likelihood of some event occurring at some point in the future, not necessarily immediately, with safety, which has a more of a present meaning. That is present danger, as I've mentioned before, something that is in very, very much in the offing and that represents a very serious threat. And so when you talk about now safety in the US and most child welfare systems, people a lot of times are talking about safety threats. They mean something that is very immediate, that's very serious, that's very severe, and that either has or could do harm to a child in the very near future. So before I go any further there and with this discussion, let me stop and see if you have a comment or question. Looks like that Ryan is gone somewhere. So any thoughts about the meaning of child safety before we go on here? Okay, so let's talk about the safety framework here, the framework that the agency is using here, the caseworkers who file dependencies and so forth. So the first part of that framework makes it a strict distinction between a child being safe or unsafe. And so I want you to think about this for a second, and whether this makes intuitive common sense to you or whether it's very, very doubtful. So think for a second, I mean, in terms of a concrete kind of way, is it really true that children who are reported to CPS, is it true that they are either safe or unsafe? Because that is very much of a feature of this particular system. And so remember how safety is being defined here. Safety would mean there's a safety threat, it's present or it's impending. It constitutes danger. It could cause severe harm to a child immediately or in the very near future. And a child in that situation would be deemed unsafe. And then you sort of reverse it, and any child that's not in that situation would be deemed safe. So safe versus unsafe. And so it seems on the surface of it, at least to me, stating an opinion, that's really not defensible. I mean, I think it would be very hard for thoughtful people to make this argument and to maintain it once you sort of have examples. And so just some sort of common sense examples. We don't normally, in outside of child welfare, we don't tend to think of safety in terms of the dichotomy, it seems like to me. I mean, if we think of it as more of it's a matter of degree. I mean, there are reasonable degrees of safety, but they're not complete safety. I mean, some of you probably have kids, you have grandkids. Those kids, even if they're living in an ideal situation, they're not completely safe. I mean, you can say they're reasonably safe. I mean, we hope they're safe, reasonably speaking, but there's always some kind of risk involved there. And that's part of the anxiety of being a parent. I mean, that's even when you have all the resources you need and lots of emotional support and all kind of help, there's still a degree of risk there in relationship to all kids, it seems like. And that would be true very much so in families that have been reported for child abuse and neglect. So nevertheless, in terms of this safety framework, and I want to go back to this, caseworkers are making a determination whether kids are safe or unsafe. And they're doing that, an investigation, and they are making that call. They are not, for example, saying, well, a child is sort of reasonably safe or moderately safe or safe now. That would be a reasonable thing to say in some situations. They're saying that a child is safe versus unsafe. And this is very much in contrast to risk assessment models that sort of saw risk as a matter of degree. So, you know, in the risk assessment model thing, which this state used for many, many years, and caseworkers, by the way, in this system are still filling out a risk assessment form. It's just that they're not seemingly using it for decision making, but they're still filling out a form at the end of investigations or so on, right? So in that, you can talk about low risk, you can talk about moderate risk, moderately high risk kids. In other words, a whole continuum of things. And even a lot of high risk kids wouldn't be considered to be in danger. I mean, not immediately at the moment. That's within a risk assessment kind of a framework. So there's something, you know, again, stating a personal opinion, just a view of mine. There's something distinctly odd and weird about that. That why these agencies would be insistent on this dichotomy, this either or thing. Kids are either safe or they're not safe, when it seems to be patently obvious that that's just not true. I mean, there are degrees of risk, degrees of safety. I guess that's what I'm saying, right? But that's not how the safety framework kind of operates. Well, why then would a CPS system adopt a framework where that kind of distinction is right at the center of it, right? Because, and again, my personal opinion, why are they doing that? Because they're trying to establish a threshold where CPS people, staff are expected to act or where they are not expected to act. So the safe versus unsafe distinction, it serves as kind of a threshold idea. Once kids are deemed unsafe, a CPS caseworker is expected to do something about that. That is, you can't find that a child is unsafe and just do nothing. So that is a call for either at that point, if a child is deemed unsafe, then there either would have to be an in-home kind of safety plan, or there would have to be an out-of-home placement of some type. That would be that's sort of the underlying operational meaning of that distinction. Whereas on the other hand, if kids are found to be safe, even though they could be at risk, they could be deemed as high risk within the risk assessment framework. If they were viewed as safe, then why? You know, you don't have to do anything. I mean, in fact, it's become even more common, according to their own data unit within recent years, for the agency to close out cases that they themselves are identifying as high risk or moderately high risk. It's become more common in recent years for them to close those cases out on the grounds that those kids are safe. So within their particular framework. And so in my opinion, that's the reason they use that framework, because they want to make use of that threshold. And then it operates as a sort of a, you know, kind of an okay, just in many instances where most of us would say kids are at serious risk of maltreatment, the caseworkers are not expected to do anything at all, not offer services, not open a case for services, not keep a case open because the child is deemed safe, meaning not in danger at the present moment. So again, let me stop and see if you have comments or questions about this.
Thanks so much, Dee. I really appreciate your article as well as your discussion today. I'm having a very difficult time conceptually to again I was trained to do child welfare when we are doing a lot of so-called safety assessments. Being a counselor, I think not so much about removal, but really about, is it safe to return home? Is it okay to return home? I've trained to learn to, analyze it using permanency, well-being, and, of course, physical safety or safety in general. I mean, those are three things that I've been learning. And then, at the same time, I don't know how many years ago, we were thinking about this whole disproportionality and structural racism in the system, and found out that, more kids are being, unreasonably so-called perhaps removed or kept, the out-of-home placement because of, the issue about, biases and issues around structural racism. But then now, so there are a lot of changes in the policy. Now it's kind of narrowing to, hey, we don't trust CPS. There's no need, so we narrow the definition of risk and safety to so-called immediate. Then, my social work training is telling me that it's like, okay, like you said, it's a balance between considering risk, in my perspective, and then assessing that, is it the danger, okay, if maybe immediately it's not so much, but because of other factors, substance abuse issues, history, mental health history, and support system around the family, around the child, it may not be able to keep this safety concern to be okay. So I'm just having a hard time. Would you mind to sort of help me? I guess, yeah, to kind of understand it.
Yes, and I think that's what you've said is sort of a context of what's happened here. Now, the safety framework that the agency is using, that safety framework was developed at least 20 years ago, or maybe even a little bit more. And it was developed before all the, recent arguments about abolishing child welfare and getting rid of child protection systems entirely and so forth. Before all of that, the safety framework was developed. Well, one of the reasons that it was developed was because a lot of these public agencies over the years, including in this state, have worked very much in a chronically understaffed mode. So they've been expected to do a lot more than they can actually do with the person power that they actually have. And that has even gotten worse in recent years because they've had so many recruitment and retention problems in the agency, not just in Washington, but all over the country, right? Well, what do you think is going to happen? Let's say that you're a caseworker and you could reasonably investigate or assess a couple of reports a week. But, so that would be a reasonable kind of assignment, maybe 8 investigations a month. But what if, in fact, you're being assigned 12 to 15 or 20 investigations a month? How are you going to deal with that kind of issue there? And so over time, what happens then when people are chronically put under workload pressures that they can't manage is they are going to narrow the range of concerns that they focus on. And the safety framework gives them kind of a permission to do this because it's only a very small fraction of CPS reports, even the screened in reports. And of course, lots of reports are screened out, but of the ones that are screened in, it's only a small fraction where there are going to be those kind of immediate safety issues. The risk of imminent harm issues that would lead to a discussion of whether there should be an out-of-home placement or not, right? So in past years, just a contrast, the idea would have been is that lots of kids would not have been viewed as being in danger. There would not have been the idea when I worked in the agency a long time that a lot of kids who were being chronically abused and neglected, they weren't necessarily in danger, but they were being chronically abused and neglected, and they were being harmed by that abuse and neglect in a gradual, cumulative kind of way. So the idea there, of course, was that we were going to provide, hopefully, some kind of service that was going to either prevent or reduce that kind of future maltreatment, right? But what's happened with the safety framework is that the agencies have given themselves permission to do absolutely nothing about a large number or percentage of those cases. So in other words, even when you move outside all the issues of racial disproportionality, racial disparities, structural racism, and so forth, the safety frameworks have been useful from the standpoint of the agencies being able to manage the workload pressures that they're under. If you're understaffed, you're going to do some fraction of what you're expected to do. You're not going to do all of it because you can't. And so then you have to narrow kind of the range of concern there. So there has been a very puzzling thing that has happened, not just in Washington, but all over the country in recent years. The number of kids in foster care within 5 years has gone down by 1/3. So that's a huge reduction. I mean, a huge reduction. That's like 80,000 kids fewer in care than there were in 2019, something like that, right? One of the biggest reductions in numbers of kids in care in the last 30 or 40 years. There has not been a big increase of families receiving services, however. So you would expect that if kids who otherwise would have gone into placement, if they're being maintained in their own home, you would expect that these agencies would have invested in services that could help the kids in their own home. All kinds of resources there. That has not, in fact, happened, either in this state or in most other states for the most part. There has not been an increase in the percentage or number of families who are receiving services. There are still families who do receive services. There always have been, but it hasn't been an increase that is proportional to the reduction in foster care, right? And so what has happened is that persons in child welfare, and to a certain extent, especially in this state, judges and commissioners have simply bought the argument that CPS a lot of times does more harm than good. Putting kids in foster care harms kids rather than helps them a lot of the time. So better to do nothing than to actually try to do something to reduce the risk of child maltreatment, or do something about the harms of child maltreatment. So in recent years, I particularly hear a lot of comments about the harms that foster care does. And some of those comments are true, and there's some research to back that up. But there also is a massive truckload of research about the effects of child maltreatment on kids. And I don't mean just child maltreatment itself, but I mean the things that go with child maltreatment. So I mean substance abuse, domestic violence, mental illness, particularly those things, particularly in combination. There's a huge research base that's referred to adverse childhood experiences research about the effects of growing up with maltreatment and the risk factors for child maltreatment over a lifetime, not just in childhood, over a lifetime. Somehow, all of that research has been minimized or ignored, and the focus has been on the harms that foster care does. So that has been sort of the recent kind of context of these kind of discussions. Now, so here I want to make sort of a distinction. Now, the first distinction, so I've told you a little bit about the safety framework. I've told you again about how the agency is using the alleged difference between safe and unsafe. So they're talking about present danger, kids being unsafe, that's present danger. But there's lots of kids who are growing up with chronic maltreatment, and particularly the chronically neglected, chronically maltreated, sometimes neglected and abused kids, where they're not in danger, but they're being abused and neglected on almost a daily basis and in a variety of ways. And that kind of maltreatment is doing harm to those kids. There is a huge research base to show that. And that means both physical harm and emotional and developmental harm. Somehow those kids within this safety framework can be viewed as safe, as amazing as it sounds. You can be a chronically neglected kid. You can have 30 reports within the agency. You can have 15 of them founded. You could be living in a home with substance abuse, domestic violence, and mental illness, and you could be deemed safe within that family within this safety framework. And, and I'm giving you kind of an extreme instance here, and yet this is not fiction. This is actually how these systems are actually working now. So part of what that safety framework is, it serves as a rationale, partly a needed rationale for how to deal with workload pressures and issues, as I've already mentioned. And at the same time, it's giving people sort of a permission not to do anything about a lot of chronic maltreatment. And by the way, for a lot of chronic maltreatment, you don't need a risk assessment form to figure it out. It's obvious on the surface of it. I mean, the family has 20 reports. The kids are being abused and neglected on practice, just not in a way that puts them in the hospital, not in a way that puts them in an emergency room or something like that, right? So one of the things, for example, that we know about chronic neglect, and particularly chronic neglect in infancy or toddler years, is that it compromises kids' immune systems. And what that concretely means is if kids get sick, they are less likely to recover. So kids who have compromised immune systems have higher rates of child death in infancy and toddlerhood. So that is a physical safety, but it's not a safety threat. It's not something you can say that if a child is neglected tomorrow, then they're going to die of a childhood disease in 2 months or something like that. You wouldn't be able to say anything like that. But it would also be very, very weird to refer to that child as safe. They're not unsafe in the framework the agency is using, but they are unsafe in an objective sense. They're not immediately unsafe a lot of the time. So that's sort of the issue related to the safety framework here. It sort of has a big areas of a blank spot. And the biggest of those blind spots is chronic maltreatment, which a lot of times is chronic neglect, and sometimes it's chronic neglect combined with either physical abuse or sexual abuse. And that kind of neglect, just to say this again, has effects on kids throughout childhood and across the lifespan. And those are physical effects. Those are physical effects on disease rates. And that includes elevated rates of heart disease, diabetes, gastrointestinal illnesses, all kinds of mental health phenomena such as depression, suicide attempts, sexually transmitted diseases, a whole range of health and mental health effects over the lifespan, right? So somehow kids growing up in that situation and being put at that kind of risk over the lifespan can be viewed as, quote, safe in this safety framework that the agency is currently using. So therein lies the issue from my standpoint, right? So there's something wrong. So in a common sense kind of way, I think most of us would understand the difference between being safe and being in danger. I mean, there's such a thing as we can be in danger, but even if we're not in danger, we may not be truly safe, in the sense that whatever is endangering us can come back next week, next month. And in fact, it often does there. So before I go on here, let me stop here and see if you have comments or questions here.
Sorry, another comment or question again. I can't quite remember exactly when, but I remember a few years back, there were some federal secretary of child welfare people talk about, more about prevention. At that point, I was kind of like a little bit, actually encouraged, so, it's like, okay, maybe perhaps, yes, we may not be able to trust that CPS is able to handle whatever reason, staffing or whatever reason or conceptual problem or blind spot. But the hope of the matter is to address that whole, like we just talked about. Thank you for bringing it out about that whole issue around ACEs, meaning how to support family, how to protect children, so that they don't need to deal with those kind of huge issues for themselves, as well as actually a lot of cause and problem for the whole society. So I guess my question is where are we going with that? I mean, is there something happening from that thing that I heard a few years back, or nothing?
Well, I mean, there's lots of discussion about it, and I think it varies kind of from state to state, the extent to which states are investing in anything that might be called a prevention kind of effort. But there are some states that actually are. So one of the most recent interesting things that happened was, if you remember, during the pandemic, the federal government then basically you gave income support to families that had children. And this even meant middle class and upper class families that had kids, in order to try to generate political support for giving income to low income parents. Well, it turns out that that kind of income support stuff really has a basis. There's a basis in research for saying that that actually works. And so for years, I have proposed the idea that this state should take dead aim at severe poverty, not poverty sort of the way the federal government defines it, but severe poverty. So take about half the federal poverty standard, which would mean that families make under $12,000 a year. So just think about that a minute. Think about living anywhere in this state, and particularly in one of the urban counties. I live in Pierce County. I'm thinking about families living in Pierce County on $1,000 a month or less. Families living in King County. I just saw recently the Seattle Times, within the last 3 or 4 days, printed a story about the difference between the median income, sort of the average income of the top fifth of income earners in King County with the bottom fifth. And the difference was, if you can believe this, an average of $439,000 a year for the top fifth, not the top 1%, the top fifth of families in King County were averaging $439,000 a year last year. And the bottom fifth of the families, not the bottom 1%, the bottom fifth of the families were averaging $21,000 a year. $21,000 a year living in Seattle, where the average rent is probably in the $2,000 a month area for a 2-bedroom apartment, right? So, yeah, so if we did, if this country did anything halfway sensible or reasonable in the prevention area, the first thing it would probably do would be to knock out severe poverty. And we have the potential in this state to do that. That's not an impossible thing to do. Now, lots of communities in this state and in other places as well have very, very excellent prevention programs that have been invented by locals. That is, that aren't necessarily a result of any kind of federal initiative or not even a state initiative. That local people just developed them. They just did it. And of course, that's very spotty. And it depends on where you kind of live. But one of you I heard recently is from the Spokane area. Well, I worked there for 17 years. Well, I was a part of the group in Spokane that developed the Vanessa Behan Center, which used to be called a crisis nursery. That is kind of a model prevention program in this state. And so now it has a whole range of family support stuff. I live in Pierce County. There is a center here called the Multicultural Center, which provides a whole range of services to families, mostly low-income families, from the time that kids are babies until they graduate from high school. I mean, there really are those kind of there are those kind of programs all over the place. What we don't have is a systematic approach to growing them or to building them. But of course, that's what a wise society would do. A wise society would say, we're going to head this off at the pass here, insofar as we can, right? But what's actually happened with the child welfare systems in recent years, because they've been so understaffed and so underfunded for the most part, is that most of them have come up with ways of totally defining themselves out of the prevention business. And so for the most part, state child welfare systems are saying that, well, that's just not our role. I mean, as much as we support it, it's not something we're able to do and so forth, and right? And so that would probably be the general party line of child welfare directors around the country, though they would love to see, I think most of them, a big investment in prevention type of program. So there was a thought 5 years ago that when Family First legislation passed in 2018, that gave states the possibility of using 4E funds. 4E funds have all historically been used for foster care. So Families First then gave the agencies, state agencies, the opportunity to develop plans to use 4E funds for various family support services that would keep kids out of foster care. And so at the time that legislation passed, you would think, and with the support of Casey Family Programs, all kind of foundations all over the country, you would think that there would have been a huge investment in these kind of services and so forth. But it just, in the first 3 or 4 years, as amazing as it sounds, I think the total 4E expenditure there out of Family First across the country was $27 million. I think last year, $27 million in 4 years or something. Last year, I think annually it was $167 million. In a country that's spending $33 billion on child welfare. So even these sort of funding mechanisms that have been, people hope would be the basis for improving services and investing something in prevention, for whatever reason, the states really haven't taken advantage of them. So there's a lot of work to continue to do there. Now, something I want to talk about here before we run out of time is I want to talk about the difference between risk of imminent harm kind of issues at the front end when kids come into foster care, and the kind of issues that all of the CASAs and guardian ad litems, all of you are facing in making decision-making about when to reunify kids and how to think of safety there. So the first thing I want to offer the idea is that when you talk about a child who's been in foster care for, say, perhaps a year, due to some form of abuse or neglect or something, and you're talking about reunifying the kids, I don't think any sensible person is saying to a judge, well, I'm quite sure that this child will be safe for the weekend, but I don't know after that. Or I'm quite sure that this child will be safe for the next week or two, but hey, this mother has a history of relapse. After that, I'm not quite sure. No sensible person would say that to a court, because a court is going to want some kind of assurance here that the child would be safe for the foreseeable future. That is, we're not talking about risk of imminent harm when we make reunification decisions. When we talk about child safety and reunification, we're talking about safety for the foreseeable future. Safety for the foreseeable future. So, of course, what sometimes parents' attorneys say, and they're right here, is that agencies are using different standards at the front end than they're using at the back end. That is, there's a much higher standard for taking a child in care at the front end than there is for keeping a child in care once a child is in care, for the reason that I just mentioned here, is because decision makers, and that includes you and courts and caseworkers, are going to want to know that when kids go home, there's a reasonable expectation that they will be safe for the foreseeable future. And so in there, you're not talking about just issues related to current safety threats or to current danger. You have to have a wider kind of view of safety when you make those kind of decisions. So let me just stop here and see if you have thoughts or questions on that particular subject. Okay, so maybe next time I could say more about this safety decision making as applied to reunification, and maybe next month I will, because I've developed a set of criteria there that I refer as MIR, which would hopefully help people inform decisions that they make of reunification kind of a nature there. So what would be the grounds for believing that a child who has been endangered before or actually been seriously harmed would be safe for the foreseeable kind of future there? And it wouldn't be, to say this again, it wouldn't be an imminent harm kind of decision. It wouldn't have to do with immediate safety threats in the environment, and it would have to be something broader than that. So. Okay, so I want to go back and discuss just a little. So first, I think I want to give you guys just test your kind of your intuition here. And so I'm going to give you just a little bit of information about a case, the kind of case that might come to the attention of CPS, and just ask you real briefly what you would want if you were making a safety decision. What other kinds of things would you like to know here? So imagine that you have a 5-year-old child. So this is from an actual case that I handled years and years ago when I was a caseworker in the Spokane office. Okay, so imagine that you have a 5-year-old who comes to the child care center where he spends a few hours a day. And this child turns out to have very severe bruising on his lower back, his buttocks, his legs. I mean, very, very severe bruising. And he says that the mother's boyfriend hit him with a belt a number of times because he had been in the bathtub, and as a sort of a play thing, he had flooded the bathroom. He had been in the bathtub, he turned on the bath water, he let it, got all over the floor. You know, the boyfriend comes in, sees that he's done that. He's infuriated. He pulls the kid out of the bathtub and he gives him a spanking with a belt. And this is what the kid says, and he just says it in kind of a factual kind of a way. And so at that point, the CPS, so let's assume that the child care center makes a report to CPS at that point, and a CPS caseworker is assigned and comes out to the child care center. What other kind of information do you think that caseworker would want to know before they make a safety determination? So they just take it at face value that this child is telling the truth about how he got bruised, and that the bruises are pretty darn severe. But at the same time, you know, he doesn't appear to have broken bones, and he hasn't gone to an emergency room. But so now a CPS caseworker is going to inquire for some more information around relative to whether this child needs to go into out-of-home care, be placed with a relative, be returned to the family, whatever. What else would you want to know other than the specifics of the incident involved? So this is the kind of thing that caseworkers then have to decide, and this is a fairly common kind of a scenario, actually. So a lot of times, a caseworker is going to, obviously, they're going to want to hear what a child has to say about the incident, but they're going to want to know something more than that. So they're going to want to know they're really going to try to determine, is this a one-time only kind of thing, or is there a pattern of such behavior? And so this is another feature, particular feature of the safety framework in this state, is that it places very little emphasis on history in terms of determining whether there's a safety threat. But I think most experienced caseworkers in this state, even today, as inexperienced as they are, they would immediately be interested in determining whether this very harsh spanking that this kid has received with a belt was a one-time only thing, or was it a part of a history of very excessive physical punishment? And so they're going to inquire about that. And they're also going to ask the child care center whether they have had any reason in the past to be concerned about anything relative to the child's behavior or their physical safety. They're going to want to look at CPS history. So again, if you want to know whether something is likely to occur in the future, so this is a kind of safety decision that a lot of times agencies are having to make. Something bad has happened in the recent past. Something seriously abusive and neglected has happened to a child in the recent past, maybe just within the last 24 hours or so. So a determination that a caseworker has to make then is this kind of event likely to be repeated in the near future? That's the safety determination within the agency's sort of safety framework. Is this child likely to be severely abused or neglected again in the near future? And to determine that, they're going to want to know something about history. both from the standpoint of what the child says and from the standpoint of there being a CPS record of past reports or not. They may want to know something about the domestic violence record of the kid, of the family. So they're going to want to know whether the boyfriend who did this spanking allegedly also, is there reason to believe that this person is violent in other ways. They're also going to want to know, particularly when I've used this scenario in child welfare training for a lot of years, and whenever there is an experienced kind of a person in this training, the first thing that experienced person always says is they want to know, when did the mother know about this spanking? What did the mother do when she found out? That's the first thing that experienced caseworkers almost always ask. Why are they asking that? They're asking that because they want to know whether this mother is a protective person in this situation. That's why they're asking that. And they're zeroing right in on the issue around, is there anyone in that home that can control this safety threat? Assuming that the boyfriend constitutes a threat to this child, if indeed that's true, and it would appear to be true based on the spanking, is it likelihood that the mother is going to step up and protect this child once she knows that there is actually a threat? And in order to evaluate her capacity, they're going to want to know whether the mother responded, in their view, appropriately when she found out about the severe spanking, and they're going to want to know exactly what it is that she did. So they're going to want to know about a protective capacity there. They're also going to want to know about supportive resources within the extended family. They're going to want to know about, is there a grandmother or their aunt, uncle, or their friends who can be helpful in this situation by taking this child perhaps for a few days, or from, being willing to be a child care provider. They're going to want to know something about the circumstances of the incident. They're going to want to know about the child care arrangements. And they're going to want to know something about the developmental impact, the developmental status of this child. Well, why would they want to know something about developmental status in order to sort of get at sort of safety issues here? And the reason is because chronic maltreatment, let's assume that there's a pattern of such spankings. The assumption then would be that if there is a pattern of abuse or neglect, then that is going to have an impact, would have had an impact on the developmental functioning of this particular child. If it turns out that this child is pretty normally functioning in a cognitive, social, and emotional way within that child care setting, that sort of moves away from the idea that there is some sort of chronic sort of nature to the punishment that the child has received. So in other words, there is going to be a whole range of concerns here. And those concerns are going to begin with history. That is going to be a major league emphasis. And the second set of concerns is going to have to do with the protective capacity of the non-abusing family member. That is, in this case, the mother. And then they're going to want to know about any kind of supportive framework that might be there within the extended family group. And they're also going to want to know, perhaps lastly, is this kid actually afraid of this guy? I mean, apart from the spanking, because of course, if he is afraid of the guy, then that suggests that he's being intimidated in some kind of way, or that there's been a history of that conduct, right? So again, they're trying to figure out a one-time incident versus a history of such incidents, whether there is a protective person in the family or not, and whether there's other people in the immediate extended family friend kind of social network that can be helpful to both to the family and to the child in this situation. So let me stop here. See if you have a comment or question. So again, I want to come back to the situation that most CPS caseworkers are faced with immediately. Most of the time, when you're talking about there being a safety threat, something has already happened in the recent past. Within the last day or two or three, something serious has happened in that situation that would deserve to be called a safety threat. It could have been a physical attack on the child. It could be a parent being inebriated and acting in a crazy, violent kind of a way. or simply not being available to feed kids, or something would have happened in the recent past. And so what caseworkers are then trying to figure out is whatever happened in the recent past likely to be repeated in the near future? That's the safety question that they're trying to figure out. That has to do with issues around whether kids should be placed in foster care. Is something that has recently happened likely to be repeated? Now, there is a whole percentage of cases, however, where families or sometimes single parents are being reported to the agency where actually nothing at all has happened in the recent past, and whether the family is being reported because of risk-only type of concerns. And so this would be the type of situation, for example, where a parent perhaps has a long history of substance abuse and perhaps has just given birth to a child in a delivery room, and the child is tested and turns out to be that the child has been exposed in utero to illegal substances and so forth. So in that particular kind of case, caseworkers then are trying to make a safety determination, but not because something has happened in the recent past, because there has been such a history, a long history or a severe history of either substance abuse or mental illness, or sometimes domestic violence, or sometimes sort of a combination of all three of them, right? And what has happened in recent years in this state is that that whole group of cases that are described within the public agency as risk-only type of cases, many of those cases have been put on the back burner, or they have been screened out at intake, or they have just, they don't pass the safe versus unsafe kind of safety determination that agencies make. So what has happened, again, in recent years that is part of the reduction in foster care as a state is that there is a lot less likelihood than in past years that CPS is going to take action based on risk only, no matter how severe that past history is. So I want to say that again. Much less likely than in past years, regardless of the severity of the history of either substance abuse, mental illness, or domestic violence, that the agency is going to take action before there is actually a safety threat in the immediate environment that they can point to. So let me just stop there. And now, how reasonable or unreasonable that is depends a little bit on what the history is. So let me just give you a couple of examples here to show you what a kind of sometimes a quandary this is. What if a parent who has a long history of substance abuse has actually had a child die, either in some kind of rollover, kind of unsafe sleep kind of a situation, or through an opioid kind of overdose, or through some kind of lack of supervision, and there's actually been a history of that. So is it reasonable then that a CPS system would ignore that history of a child death because there is not an immediate safety threat that they can point to? That's the kind of question that caseworkers and in fact whole child welfare systems have got to ask and answer, because they are faced with those kind of reports very, very frequently. And so what has happened in this state and across the country is that there has been, in the last 2 or 3, 4 years, as foster care has come down, less of a likelihood that the agencies are going to act on base of those kind of histories, no matter how severe they are, unless they can point to an actual real life safety threat in the immediate environment. Comments or question?
Thank you again. And from what I can see, when I read a lot of dependency petitions, is often, at least in King County, I see CPS, likely would engage their parents, if there's immediate, some sort of, concerns, chronic, whatever history, to engage them in some sort of what's it called, volunteer
A plan of safe care.
Or file services.
A community-based plan of safe care.
Mm-hmm.
Yeah, and last year, maybe I don't know, within the last 12 months, I actually wrote a sounding board on this particular subject. So those plans of safe care in this state, you probably know they're online plans. They don't involve personal contact between anyone and the parent. There's online contact. It's basically an online referral system. That is not a way to protect kids. Now, I'm not saying that those community-based plans could never work. I think if they're very well done, I think they could be effective, but not the way that this state is doing it. Not online, not referring someone to an agency and hope they go. And maybe there's follow-up and maybe there isn't, and no one ever does a safety assessment of the kid at all, right? Now, on the other hand, there are some kind of community-based plans that admirable. So one of the reasons, for example, a few months ago, or not very long ago, on this particular Fourth Friday kind of training, we had someone come from the PCAP program and talk about what PCAP does. Well, that's a program that enrolls mothers when they're pregnant who have a substance abuse history and follows them and the child for a period of three years. So I'm very much a supporter of that type of program. And some of those kids in PCAP remain with their mothers, some don't, some end up in foster care. So it's a whole range, and it's not based simply on the mother's substance abuse history. It's more complicated than that. It's not just because all the mothers in PCAP have a substance abuse history. And most of the mothers in PCAP also have a history very much of being themselves abused or neglected in childhood. So a large percentage of that group of mothers has ongoing mental health issues there. So, okay, so we're going to run out of time here. So I'm just going to, a couple of other things that I want to mention just because I think that would be useful to you, perhaps in your CASA role or your guardian ad litem role. And one of those issues has to do with children being removed emergently, sometimes by a law enforcement agency. And then there is a filing of dependency. And then within a few days, there is a shelter care hearing. And if the shelter care hearing, a court is then making a decision about whether this child should remain in care until the dependency hearing or whether the child can be returned to the parent with a pending dependency and so forth, right? So again, increasingly, and this is word of mouth, this isn't based on research or anything, this is just stuff that I hear. It's become very common in this state to go to the shelter care hearing and agree that if a family member or whoever, for example, might have a substance abuse problem, if they agree to go into treatment, not gone into treatment, agree to go into treatment, to start treatment, then the child is going to be returned immediately at the time of the shelter care hearing. So the idea here is that services equal safety. Now, this is the underlying kind of idea, but of course, with chronically relapsing conditions, that's completely wrong. Because someone who has a substance abuse issue or a mental health problem of a severe nature goes into treatment does not mean that their parenting is going to instantly become okay, responsible, reliable, dependable, and safe. That is very, very naive. So it's amazing to me that intelligent people, judges are smart people by and large. I don't know how anyone who's thoughtful could actually believe something like that. And yet I hear it all the time. So I guess what I'm trying to say is that by someone going into services, that doesn't mean that kids are immediately safe. So it usually, when someone goes into services, that's particularly for chemical dependency or mental health issue, that's an up and down deal. That's a rocky road involving relapse, a lot of struggle, a lot of effort. It's not a smooth walk up the mountain. And so it's going to take time then in those situations before kids can be safely returned to those parents, not at the shelter care hearing. Not based on that. Now, there might be something else. There might be a supportive relative. There might be someone who moves into there might be some kind of a context of some kind of support system that is built into the family situation that would keep the child safe there. That's not the same thing as returning a child to the family at shelter care on the basis that the family has agreed to go into services. That's something else entirely. I also, for those, lastly, I guess the thing I want to say is that for those families, those parents that have a mental health, a history of chronic mental illness, but without there being a substance abuse issue. So that's a small fraction of parents, but they do exist. They do come to the attention of child welfare agencies. So one of the guidelines that I want to offer you as CASAs or guardian ad litems is one of the things you need to be asking about parents with chronic mental illness is when they are at their very best, when they are functioning at their very best, how does that actually look? When they're on their meds, when they're involved and when they're doing their treatment program in a consistent, reliable way, when they're reasonably stable with the support system around them, how does it look when they're functioning at their best? And when none of that stuff is true, when they're not on their meds, when they don't have a support system, and when things aren't going well, how does that look when they're functioning at their worst? So particularly with chronic mental illness, because of course the idea here is that chronic mental illness is a relapsing thing. I mean, if a person is chronically mentally ill, the likelihood is that they're going to have another mental health episode. So when you start evaluating risk or the likelihood of safety issues in the future, you need to know what's likely to happen in this situation if this chronically mentally ill parent goes off their meds, or if they lose their support system, or if they break up with their intimate partner, or anything that could cause a mental health crisis, what's likely to happen in that situation? And the safety decision around a child's safety should be made in that light. It should be made in that light, in the light of what is likely to happen if there is indeed a relapse there. So. One piece of research that I pointed out before, and maybe I'll just end with this, is that particularly in the substance abuse area, there is a large body of research over 2 or 3 decades that says the following: that the shorter that kids are in, the shorter the length of placement, the more likely that if children are returned home, that they will re-enter foster care. So to say this again, there's a reverse relationship between length of stay. The shorter the length of stay, the higher the rate of reentry, up to 6 months of stay in foster care. That relationship does not apply after 6 months in care from the standpoint of research. But for the first 6 months, it does apply. So in the first 6 months, shorter is not better. When there is a substance abuse issue that needs to be dealt with in terms of treatment, in the first 6 months, longer is better from the standpoint of child safety. Again, not necessarily true after the 6-month period there. Okay, I think I'll stop in 7 after 12. So let me give you one more chance for a comment or question here.
I just had a quick question, not necessarily about this training. We're in Spokane, all of the CASA guardian items. We don't get appointed at shelter care. We get appointed weeks or months later.
Mm-hmm.
Is, in your eyes, is there we're having conversations now about getting appointed at shelter care status. Is that beneficial? Should we push harder for that? What are your thoughts?
Yes, I would push very hard to be appointed at shelter care, and that would be an understatement. I would push as hard as you can do in a civil, courteous, polite way. It's hard for me to imagine that a court would actually delay the appointment by months or something. On what grounds? I can't even imagine the rationale for that. But yes, I would push hard for that, because you really do want to have a look at progress. You want to have a look at what happens over a period of time. And so you want eyes on as soon as that can possibly be present there.
I'll just add, at the statewide level, we actually have a request pending before the legislature to appoint staff guardians ad litem at that point, right at the shelter care. The issue that we've had in the past is trying to find the right volunteer for the right case. And so there was a little bit of a delay there in terms of assigning a volunteer to a case right at shelter care because we're not sure which one we're going to get or who's going to be able to accept it. So to fix that, what we're going to do is assign a staff JL until dependency is established, and then hand it off to a volunteer from that point on. And in the meantime, with the volunteer, what we're going to ask the volunteers to be focusing on is contacting extended family on both sides of the family tree to see how they might be able and willing to participate in the dependency proceedings, or as either a placement or just as a support network for the kid. So
yeah, no, that sounds good. So next time, what I'm going to talk about, I'm going to come back to the subject of reunification and how would you make a safety decision at the reunification point where that's being seriously considered by the court. And so that's what we'll talk about this coming month there. So I think with that, I'll stop.
thank you so much, Dee. Really appreciate you doing these, and we'll see you next month.
Okay, yeah, bye-bye.
Thanks, everyone.